Good afternoon, everybody. Now, you all have probably heard me talk about having a comprehensive safety system until I'm blue in the face and you're bored out of your minds, but the truth is that it takes a whole lot of work to transform a system that has been in place over 100 years. One where when you call 911, there's basically one question, which is it violence or is it fire? If it's violence, it goes to police. If it's fire, it goes to the fire department, and that's the primary decision. Now, what we are doing is providing an integrated system of community safety that, yes, of course, has firefighters and police officers respond, but also has an array, a litany of other options that can provide a specified skill set to the specific circumstances that are happening on the ground. And over the last several years, we've been working diligently to incorporate that. A big piece of getting that foundation in place from the very beginning has been the establishment of an Office of Community Safety. That Office of Community Safety has been in place for just over a year right now. And then in July, we established a Safe and Thriving Communities report, and recommendations were announced. You all were here along with Dr. Oftali for that report. In August, we presented our 2024 budget proposal, which includes additional staff in our Office of Community Safety to execute, plan for, and carry out this work. In September, we got a new Performance Management and Innovation Director in Kira Hasbargen, who's been working very hard to get some of these recommendations up and running. Then in October, a new commissioner, and Todd Barnett, started. In November, a safety center site was collected to be a physical space where we can build out all of these different services under one roof. And then finally, last week, the commissioner appointed our new OCS position to lead some of this work in Amanda Harrington. And now today we're moving forward with a contract that will go forward at POGO for $1 million to contract with New York University Law School to provide an execution of how that comprehensive service will ultimately be carried out. Taken together, we've made some really huge strides in 2023 to establish this better and integrated system, but this is the next step for that work. So this is going to be a 2-year contract from December of 2023 to November of 2025. PMI is going to be the contract holder under the leadership of Director Hasbargen. And the focus is going to be on assessment of a program, the evaluation of a process across the continuum of care, of preventative, of responsive, and then restorative services. And then the NYU policing project can also help to contribute to the development and the refinement of the city's spectrum of services. So to give you an idea of what this looks like in reality, it's what resources and services does the city presently provide? What resources does the county provide? How do we fill in those gaps in a real and practical way in between? So I know this work is something that our residents care a whole lot about. I know the City Council has expressed interest in ultimately getting this job done. We got to do this job right, making sure that we're doing something that really has never been done in full in our state or in our country before is going to require a whole lot of due diligence, is going to require a lot of staff time. It's going to require expertise, both of internal experts as well as some of these individuals that are coming in externally to help us out. You're going to get some more of the specifics from the wonderful people that are going to be talking after me, but I do want to give a few thank yous. Because it wouldn't be possible without the leadership and the direction of some of these individuals around me. First, Director Hasbargen and Commissioner Barnett. They have been at the forefront of this work. I know they are the right leaders for this job, and they need to know that they have our full support, and they do. Interim COO Heather Johnston and Deputy COO Garnett Hahuli and Interim Deputy COO Sheehy. Big thank you for all of the work that you've done in making sure that these departments are collaborating together. Your presence in this has definitely been meaningful. And then finally, Dr. Oftali, thank you so much for leading your team to get this report set up for safe and thriving communities and getting the recommendations out. And now, thankfully, we're moving towards execution. So it's a good team that's moving on this. This is a top priority as far as where our city is ultimately going. And with that, I'm going to turn it over to the leader of this work, our new Commissioner, Todd Barnett.
Thank you. Thanks. Good afternoon. As most of you know, the Paulette Family Foundation, along with McKnight, Joyce, and Minneapolis Foundation, provided funding for the Minneapolis Safe and Thriving Communities report. That report is a roadmap at how the city can transform and reimagine how we look at community safety by providing an ecosystem of services that are preventative, responsive, and restorative. The report is the foundation for which the city's design and implementation team will need to move forward. The design and implementation team is a partnership between the Office of Community Safety and the Office of Public Service. And as you know, community safety is beyond the 5 offices under the Office of Community Safety. So it's a team effort. This team, the design and implementation team, is an example of the city's departments working together to bring the Minneapolis Safe and Thriving Communities report to life. This is a report that shouldn't remain on the shelf. It's a report in which we're trying to establish the reality of what we need here in Minneapolis. We need to establish internal partnerships, which we're doing, external partnerships and collaborations to address the diverse needs of our residents around community safety and to make Minneapolis safer. I recently appointed Amanda Harrington to the position of Director of Design and Implementation to help lead this work and carry out the vision of the Mayor and City Council to have a holistic approach to community safety with an emphasis on community engagement. I'm excited and proud about the partnership here with the New York University School of Law Policing Project and Dr. Oftali. Today is another step in building out the Minneapolis Safe and Thriving Community Report and recommendations. The Office of Performance Management and Innovation is vital to the city's implementation of the recommendations of that report. Thank you.
Hi, good afternoon. So the Performance Management and Innovation Department collaborates with residents, elected officials, organizations, community partners, businesses, and stakeholders to push for bold new ideas and create a culture of data-driven, community-centered service in Minneapolis. We have 4 large main focus areas. The first is research. The second is performance management. The third is community engagement and resilience. And the third is innovation. Our past projects have focused on community safety, alternative responses to policing, and the city's Reimagining Public Safety campaign. We are part of OCS's design and implementation team, which was shared earlier, and are here to really support the development of the city's new model for public safety through the implementation of the Safe and Thriving Communities report. It is a natural continuation of our scope of work and what we are doing to support the city. So how did we come to this request, which will be for before POGO this afternoon? We are asking that they approve a single source contract with the New York University School of Law Policing project. We understood really the significant effort and expertise that they have in this area, really a leader in understanding what it looks like to do alternative responses and other areas in which they focus. The policing project itself is designed to support strong, healthy, and safe communities to end an over-reliance on police. They have been conducting in-depth, on-the-ground research on alternative responses across the country, working with community members, municipal stakeholders, police officers, leadership, alternative responders, 911 operators, and City Hall staff. Going issue by issue, they have been producing guidance and have worked across several cities such as Denver, San Francisco, Tucson, and Chicago, and are leading the national effort to design new systems. Given their expertise in analyzing public safety systems and their engagement of report co-author Dr. Oftali, they are well positioned to move this work forward as we start the initial implementation of the Safe and Thriving Communities report, and really are the only organization out there, coupled again with the co-author's expertise, to help us start this redesign. So what is the scope of work? It was critical to us that we work with a credible partner who would be able to support the implementation, and for us not to really be able to hit the ground running. There's a sense of urgency around this work, right? The report and its recommendations were released in July, and we're excited to move forward. So the first, as I mentioned, is they are able to engage the co-author, Dr. Oftali, who will bring his unique understanding, garnered by his experience, which, through the development of the report, included interviews with government partners, community organizations, and others. His connection to the report and credibility cannot be provided by anyone else. The New York Policing Project, University Policing Project, will also perform an analysis of the city's service continuum to help us understand what assets we have that can be leveraged or expanded, to identify resource gaps that we need to address before we consider scaling our initiatives or develop new programs. And they will support the analysis of calls for service for expansion of those non-police responses. And lastly, they will serve as a subject matter expert and advisor to the city in this area as it relates to our data analysis, outcomes measurement, and visualization, helping to build out those comprehensive performance metrics, supporting the creation of a publicly facing dashboard to support transparency, and to advise on internal performance management. Their supports, right, and this collaboration with them will help lay the foundation for the city to begin an integrated, coordinated, and comprehensive approach to safety that will guide our work into the future.
Thank you, Director Kira Hasbargen. And with that, we'll open it to any questions that you might have.
I just heard the director mention that it'll be kind of some more research, right, before implementing these programs. Is there a timeline for how long that phase might last?
So the question was around the timeline of how long the implementation might last.
Well, the research
And the research.
part of it.
Yeah, I wouldn't call this so much research. The previous report on safe and thriving communities was the research end. This is laying out the execution and implementation. And so I'll turn it over to the director here, maybe to give an idea of the timeline is what they were talking about. The contract, by the way, is for 2 years.
Yeah, I think it isn't not to do more research, is to really do that analysis, to look at, again, sort of the service continuum, what that looks like. As it relates, again, the contract is for 2 years, and this is starting the initial implementation. I think there's a lot of sort of different things as we consider, how the Office of Community Safety and the Design and Implementation team is going to start piecing together a long-term strategic plan. This is the first step. So it's, again, to work with experts in the field to really leverage their understanding, so we're not wasting time doing that. It can really tap into that and then figure out with the Office of Community Safety and the full design and implementation team holistically what that longer term plan will look like.
A couple of nitty-gritty questions about budgeting and timing and stuff. So this is $1 million. Is that the total over the 2 years of it?
Yep, so it is up, the request is for up to $1 million, up to 2 years. So that is what the request of the contract. And this is, again, just for that initial implementation for those 3 areas that I described. So it's, that is the focus of the contract.
And is that million, is that starting in 2024's budget? And is that in the mayor's budget proposal? How does that all work out?
Yep. So this is separate. This, again, is becoming, as they're partnering, they'll be partnering with both performance management and innovation. It does not represent a new budget request, but I think, again, this is to start the implementation around those 3 areas that we talked about, and there may be different things that come out of that.
So this is covered in the mayor's 2024 budget proposal?
So there's not a new budget request, correct?
Maybe a little clarification. So we have been partnering with philanthropy to help fund this. And so this is money that is existing already there. And so we'll be carrying forward some of the money that has already been allocated for this in 2023 for the contract.
Okay, this comes from the full ad pool.
So, yeah. So, thank you.
And then the last question, was this put out for an RFP? I'm sorry, this may be old news, but or how was this done?
The answer, no, it's single source. And please jump in if I get any of this incorrect. No, it was not. And the reason is this was the entity pretty much nationwide that was able to conduct and carry out this work.
I have a question for the commissioner, unless we, so we're talking about kind of reimagining, right, public safety in general is a concept people have to wrap their minds around. What's the balance here? Is policing 50% of the public safety equation? Is it 80%, 30%? I think people are wondering how much of a presence these other programs will have and how you see the equation.
You know, we've talked about this before. There's no percentage. We can do both. We can do good policing. At the same time, we're building up our crime prevention and being proactive. So I don't think there's a percentage that we're looking at. I think it's just taking this report and implementing it is important.
Do you have any examples of what were the three things? Preventative, responsive, restorative services? I mean, in any of those pools, could you give people an example? I think a lot of this is abstract to people. So what does an actual program look like? What are some of these ideas? I don't know if you have anything to share with people.
Yeah, I think, well, if you look at the report, and I'll leave it to Dr. Oftali to talk about the ecosystem and responsive services, or the preventative services you should think of as crime prevention or proactive services, right? Things that we already see with our behavioral crisis unit that's out being proactive. When you think of responsive services, again, think of those services that we could deploy to help people, again, like in mental health and other areas. And then restorative, I mean, just think of this restorative as restoring someone back into the community or back into a better position. That restorative could be services like substance abuse or something like that. But I can leave it to Dr. Oftali to talk more specifically if you want to.
Thank you for the question. First, let me just say this as well. I think since we launched the Safe and Thriving Communities Report, Mayor Frey has been just excellent at pacing this and moving this forward with the new team members, with the vision, with the mindset of let's actually implement this report for the betterment of the communities of Minneapolis. And so I'm just thrilled to be back here in Minneapolis, again, my hometown, to help move this forward even more under the mayor and his team. So to your question around the continuum of the services, what they look like, it is a big question, and we do this, we define that with community first of all, but you can look at it as what we called an ecosystem in the report, where if you think about individuals and families and communities within Minneapolis in the center of, say, a circle, there are these services that can wrap around that family. Some of those services are what we call preventive. And as the commissioner mentioned, those are things that are getting more to the root cause of challenges in communities, the challenges to safety and to and things that drive crime. So what do we do to bring services in that reduce those issues, that get to the root cause of issues to make sure that people are safe? So there's an array of services around that, from violence prevention to education services to being better at workforce development in certain communities, et cetera. Then that continuum moves into what we call responsive services. And here is really where services start to collaborate a lot more. So that in real time, so if something happens in a community or for a family or an individual and they call 911, 911 has the ability to say, what mix of services can we send out to this person or this community to make sure that we respond with the most appropriate form of response, the most appropriate service. And often that can be a mix, and this is where we'll do a lot of work in the coming months to really clearly define what that mix looks like. So it could be that that 911 sends out a 25% police response and a 50% mental health response, and then maybe someone doing restorative services to help with trauma. in that particular incident. So that mix of services in restorative will be very important, and responsive, I should say. And then as we get into the restorative services, as the Commissioner said, this helps people to get back into the community. Really good focus on trauma-informed services. So when something unfortunately bad happens in the community, particularly something like a shooting, there's a lot of trauma that's associated with that, not only for the victims, but also for broader community members and family members. So what can we do as a city to make sure we have the services that go out to that family or that community or that block, whatever it may be, and say, you know, here are things we can do right now to make sure that you feel safe, and that you're, you know, you feel heard, and that we can do together to make sure that this doesn't happen again in the community as well. So it kind of connects into prevention in the future as well. So those three types of service categories are what we'll really take a look at with this contract with NYU and the policing project to make sure that we have a real strong set of very clearly defined services across this entire continuum or that ecosystem, in order to importantly be able to come back to community as well and say, what should this look like exactly for you? And to be able to go back to the rest of the city and city council and say, how much will this cost to build this out, and what capabilities do we need going forward to make sure it's implemented well and with the vision towards equity and in ways that that lift up all communities. So we can't give you really, you know, we could go for hours about exact details of services, but that, I think, hopefully provide a vision.
My last follow-up is to the earlier question of when will people start seeing this? I realize it's not going to be a precise answer either, but when might some of these services show up on a more regular basis for people?
Yeah, I'll start and then I'll hand it over to Director Hasbargen. Some of these services you are already seeing. We have a behavioral crisis unit that is operating as we speak to make sure that people that are suffering from some form of mental trauma are able to get care in the immediacy that is not simply from an officer with a gun. We have our Department of Neighborhood Safety right now that is rolling out services like Next Step hospital-based intervention, where someone that was a victim of a shooting gets an immediate touch point, some outreach, so that they can not only get healthy, but perhaps get out of a life where they're more likely to be subject to a shooting themselves. We have violence interrupters. We have all sorts of work that's going on through DNS, including group violence intervention, that are programs that exist now that are safety beyond policing. Now, what we're talking about is bringing a lot of these programs to the next step. So many of them have operated perhaps independently from some of the other work that we have happening within what we traditionally consider safety, which was police. That was the response for safety issues. It was send a police officer. And that one police officer was charged with doing everything from keeping things safe in the immediacy and stopping bullets from getting shot, to arresting people, to doing social work, to mental health response, and a whole other array of services that obviously they can't provide, are not going to provide it, are not equipped to do so. So the question now is, how do we give that full and comprehensive method? And you know, it's not going to happen overnight. It won't. And for those that want it to happen overnight, I'll tell you, we could probably get something set up and it's going to be shoddy. So let's do this right, because we want these services to be serious and we want them to last for many, many administrations. And so this is about doing the right work to get the foundations set up from the get-go.
The document, the mayor just outlined a bunch of programs that are already happening. And it looks like one thing we'll be doing is trying to gauge the effectiveness of those particular programs. How do you approach doing that, and what can the public expect about what they'll be able to see about whether it's actually being effective or not?
Yeah, as the mayor said, there's already a number of services that are working in the city. Part of this overall work is also continuous improvement of that and scaling services up. And so in this next phase of work, we'll be looking at, again, as I mentioned before, that full spectrum or ecosystem of services, and what exactly should we have that the community is asking for, and how do we build that going forward. A big piece of that will be working with community to clearly define what types of outcomes are we looking for in your community, right? So the outcomes they're looking for will flow back towards the outputs the city has in the form of a service, and we'll want to have measures around that. So if we'll take those outcomes and translate that into, well, what does this look like operationally, and how do we measure the effectiveness and efficiency of these programs going forward as well? And that will enable us to not only track over time how well these programs are doing and services, but also tune them over time as well. So we want the city of Minneapolis and the services and all the other partners and collaborators with those services to be able to analyze in real time, how are we doing with these services? And how do we innovate day in, day out to make sure they're more effective, more efficient going forward? How do we track that over time? And really importantly is we're going to put in place a dashboard for community to say, here's all the services that have been stood up in the city and with the community, and here's the status of them, and here's what's resulting from those. And at regular intervals be able to have that dialogue around what can be improved and where we improve it.
Can you talk really quickly about the process in other cities that you've worked in and how potentially it's different from Minneapolis?
Yeah, so first of all, when we developed the Safe and Thriving Communities Report, we scan nationwide what's happening well, what maybe isn't working too well, what cities are in the lead on certain things. One of the main findings from that, as we mentioned before, was that there is no one city that's doing this exceptionally well. There are some good pockets of innovation in certain cities, certain pilots they may have or initiatives that they have that are, I think, exemplary of what the future may look like, but no particular city that's doing it, comprehensively. So answer number one is that, in Minneapolis, what we're hoping to do here under Mayor Frey is to make sure that we are the city that's leading the country in this. Then in a few years we can look back and say it was done here in this city first, and this is what we'll look for. So a big piece of that, I think, will be taking some best practices that we already know that have been documented in the report already, the great work that's already happening in Minneapolis, and looking at how we scale those up, and really importantly how we tailor it here to community and tune it in a way. Am I getting to your question? Is it?
Yeah. So I mean, as far as community meetings, will it be like meetings, you see public meetings, or how do you do outreach?
Yeah, I may defer a bit to the commissioner on that, but I guess what I would say is that we had a really solid core of research that we had with the Safe and Thriving Communities Report with community, with different services organizations in the community. So we have a good baseline there. What we'll do as we project a bit into, provided we have this contract in place, we'll have executives with the NYU Policing Project along with myself, and we'll work directly with community again to clearly identify these types of services. So I think the form of that will be probably some community listening sessions, some design sessions with the community, in ways that we can put the appropriate service mix together, if that makes sense.
We have time for one more question. Mayor Frey, what is the feeling right now in terms of whether Provo will approve this contract or not? I know that a few months ago there was some skepticism, some pushback with this report, with some council members saying that a lot of the things in the report are echoing some of the same ideas that they've had in the past. Do you think this is going to get approved today?
Yes, I do think that it will get approved today, predominantly because some of the things that are coming forward in this report were requested by people that haven't always agreed with me. This should be an area of unity. Every single person on the council, every single person in my administration believes in a comprehensive approach to community safety that includes all of an array of additional services that we are trying to offer in a thoughtful way. Offering them in a thoughtful way means that we do our homework ahead of time. It doesn't mean we just hire out for positions that don't exist yet under a job criteria that we're not entirely sure of to serve a community that may or may not be getting the service in some form that we want to be providing. It means doing that work ahead of time. Some of this work that happens, a lot of the work that happens in government that is the most important is the least sexy. So, of course, it's exciting when we roll out with violence interrupters or a new behavioral crisis unit. But it's also important that we find ways to embed them in full in the work that we're doing at City Hall so they're more than just a pilot. We want to do this work ongoing. And as you know, the behavioral crisis work, for instance, it has ongoing funding. It's going to be there forever, or at least until somebody takes the ongoing funding out, and I certainly won't be the one to do it. We also want to make sure that there's data and transparency attached to the work that we're doing. We have these portals that are set up that allow you to see crimes that have occurred in the city. We have other portals that are set up around what specifically MPD is doing. We also need to be transparent with the safety beyond policing work. If you value something, if you want to instill it for a long time, you want to make sure that they have the same kind of compliance metrics that are set up for other older departments within the city. And so that's a big part of what we're rolling out with right now. So we're doing this work seriously. We're taking the work very seriously, which is why we're hiring the most serious individuals to be carrying it out, in Dr. Oftali, in our commissioner, in Director Hasbargen, and in our new, I don't remember the title exactly, but Director and Amanda Harrington. Thank you so much, everybody. Appreciate it.